Hello everyone. So in this session we are going to talk about a very important topic, that is the venous drainage of lower limb and also about the lymphatic drainage of lower limb. So in this category, first thing which I want to tell is the great saphenous vein, a very important, why it is called as saphenous, because it is easily visible and it's a very longest vein. So let's talk about the course of the great saphenous vein. So first thing is that if you will see this image, I'm just slightly enlarging it. What you can see on the dorsum of the foot, it is formed, and it is formed by the joining of medial marginal vein with that of the medial end of dorsal venous arch. Okay, so firstly I just want you to explain. So what you can see exactly, the formation is by the union of medial end of dorsal venous arch and that of medial marginal vein, and thereafter it is traversing upward. It passes anterior to that of the front of medial malleolus. It travels upward and about 2.5 centimeter front of medial malleolus, cross the medial side of the lower 1/3 of the tibia and then ascend slightly behind. If you will see the level, it is lying behind the medial epicondyle. It is lying posteromedial. अगर आप upwards इसके course देखते तो it is lying posteromedial. It is lying posteromedial aspect of knee joint. It is lying on the posteromedial aspect of knee joint. Okay, and it passes upwards medially in the thigh. So it is passes medially upward in the thigh, and it will pierce the cribriform fascia and drain in the through the saphenous opening and will drain into the femoral vein. So exactly this is in short about the course of great saphenous vein. So I want everybody to write down the course of great saphenous vein. So let's write on the heading, everyone. Course of great saphenous vein. So if I am using the word great saphenous vein here, अभी great saphenous, the word saphenous का मतलब क्या हुआ? The word saphenous का meaning है easily visible. It is easily visible. When the person or the students are going for the dissection of the lower limb, ये जो saphenous vein है, it is easily visible to the students. So formation. First thing is to know about the formation. So the formation is, it is formed by the union of, medial end of, medial end of dorsal venous arch of foot and medial marginal vein of the foot, So this is how the formation of great saphenous vein takes place. So after that, if I talk about this, this is how it formed. Thereafter, it will pass upwards. After its formation, it passes upwards approximately 2.5 centimeters in front of medial malleolus, So it will pass 2.5 centimeter in front of medial malleolus and will cross medial surface of lateral 1/3 of tibia. So it is crossing medial surface of the lateral 1/3 of the tibia and then ascends little behind. Then it will ascend little behind medial border of tibia to reach the knee. So it will reach the knee, and exactly it will reach on which aspect of the knee? So it will reach on the posteromedial aspect of the knee. It will reach posteromedial aspect of the knee joint, and about so exactly it will then pass upwards. It will be passing posterior about it will be 1 hand breadth, so 1 hand breadth posterior to the patella and will pass upwards medial side of thigh and ultimately will traverse through the saphenous opening. So it will traverse through the saphenous opening and it will pierce the cribriform fascia. What it will do? It will pierce cribriform fascia and will drain into femoral vein, and ultimately it will drain into femoral vein. So this is in short about the whole course of great saphenous vein. So this is in short the whole course of great saphenous vein, which is important for you. So we have discussed here about so what we have discussed here is about the formation. So first thing which I have discussed is the formation of great saphenous vein. Then we have discussed about the course and ultimate drainage into the femoral vein, which has been discussed. Thereafter, what is important for us is to know, so course we have discussed the tributaries. So ultimately we have talked about all this. Now I want in short about the tributaries of great saphenous vein. So here you can just write the tributaries of great saphenous vein. Tributaries of great saphenous vein. So let's talk about the tributaries of great saphenous vein. So first thing is the tributaries of great saphenous vein. I would like to tell about the first category of tributaries, which is at the commencement. So at the commencement vein formation, at the commencement, so at the commencement we have got following tributaries, and these are medial marginal vein. This is medial marginal vein of big toe. This is medial marginal vein of big toe. Other than that, we have also got that formative vein will join with the medial longitudinal arch, medial end of the dorsal venous arch, but at the leg. The next important point is to know the tributaries at the level of leg or in the leg. So please write down the tributaries in the leg. So in the leg, we have got following. We have got a communicating vein. We have got a communicating vein. So this communicating vein is given to small saphenous vein and also to the deep veins. Other tributaries which is given in the leg is posterior arch vein. We have got posterior arch vein connected by medial ankle perforators. Now, so here I just want you to show the tributaries. This is the dorsal venous arch, medial marginal vein. We have got medial ankle perforators. As I told you, it is connecting posterior arch vein. Then coming to exactly just below the knee, we have got anterior leg vein as shown in the image. Okay. Other than that, in the thigh, we have got posteromedial vein and anterolateral vein. Posteromedial vein is also called as the accessory saphenous vein, and just before piercing the cribriform fascia, it is giving the three superficial vein which is corresponding these veins, that is superficial. As you can see, the name are superficial circumflex iliac, superficial epigastric, superficial external pudendal. So they are running along with the superficial branches of femoral artery, and one that is if I talk about just before the termination in the femoral vein, it gives deep external pudendal vein. So write down the tributary. So we have written about the in the leg. Now I just want everybody to write the next category, that is just below the knee. Tributaries just below knee. So the tributaries which is lying just below the knee is following. They are, so I would like to write 3 here in Roman. And just below the knee, the tributaries are anterior vein of leg. We have got few veins from calf. We have got few veins from calf that communicates with small veins, that communicate with small saphenous vein, This is just below the knee. Now in the thigh, we have got following veins as the tributaries, and they are anterolateral vein. We have got anterolateral vein. We have got posteromedial vein, Actually, the other name of posteromedial vein is accessory saphenous vein. Now talking about the other one, the fifth is, so just before piercing the cribriform fascia. So just before piercing the cribriform fascia, so if you want to write, you can just write fifth one, just before piercing cribriform fascia. Before piercing cribriform fascia, we have got 3 superficial veins. Actually, these 3 superficial veins are corresponding with the superficial branch of femoral artery, and they are A, B, C. Please write down the name. They are superficial circumflex iliac vein. They are superficial circumflex iliac vein. They are superficial external pudendal. They are superficial epigastric. Superficial epigastric vein. And just when it drains into the femoral vein, so just before draining into femoral vein, the sixth one, just before draining into the femoral vein, it gives deep external pudendal vein. It gives deep external pudendal vein. So got it? So these are all the tributaries of great saphenous vein, and it is important that you should know the name of these all tributaries. Now the next is, so before proceeding to the next one, I just want everybody to please note down, great saphenous vein has got how many valves? So the valves in the great saphenous vein is GSV. Great saphenous vein is having 10 to 20 valves. What is valves? Valves are for the unidirectional blood flow, that blood is flowing from superficial to deep veins.